Hey everybody, I'm here with in Arizona with my bro Keith Snidman. I, of course, am the evil twin brother Franz Snidman. But Keith, I like these little car interviews. Let's talk a little bit about why sometimes movement in itself will not remove restrictions in the body. Like, we hear a lot of people that just say, no, you don't need to do soft tissue work, you don't need to use foam rollers, you just gotta move your joints and everything's fine. Why doesn't that work in some cases?
Well, depending on what kind of restriction you have. I mean, you can have scar tissue or kind of a collagenous mess, I guess you could call it, from old injuries or just working out, just accumulated repair of damaged tissue from strength training, high-level sports. Even if you just spend a lot of time in a very sedentary posture, if a muscle just is ischemic for long enough, there's some research that shows that the body almost interprets that almost like an injury, and will lay down types of collagen which will limit your range of motion. And that's very tough tissue. It has the tensile strength. I can't remember the exact amount of force that it can handle, but it's a lot. So once you've developed enough of those restrictions, and a lot of these restrictions can also just be in your brain, kind of this whole mind map idea, so that's a whole nother story. But in terms of the actual tissues, once you've developed these restrictions, it's going to pretty much cause what's called a relative flexibility problem. So you're basically going to avoid moving in the areas that are restricted. So if you have a muscle group that's very stiff, and it's causing one particular joint to not move, that joint would be probably the muscle that tendon crosses or attaches to. You're going to move instead somewhere else, and that's really a big problem with just trying to.
Is that compensation?
It's just a compensation. It's just a compensatory flexibility problem, a relative flexibility problem. Shirley Sarman, the physical therapist, actually I don't think she's really big on soft tissue work, but she does recognize this a lot. That's a big basis of her therapeutic or rehabilitative approaches, is to try to decrease the stiffness in the areas, for instance, like the hip flexors, and that would translate to better movement of the hip joint and therefore less movement of the lumbar spine. So the lumbar spine is a typical area where you're going to move too much in rotation. This whole joint by joint approach obviously is very much based on those type of theories, that there's just too much restriction or stiffness in some areas, and then you're going to get these compensatory movements somewhere else. And so you may appear to be moving, or sort of like if you were taking a yoga class, if you really didn't look closely, you might be doing a pose and it looks okay, but to the trained eye, you're going to see all kinds of compensations that are actually going to be stressing out particular joints too much. And so you can cue them manually and just tell them, and that might help. But some of those tissues where you have that increased sort of scar tissue or collagen might need to be mobilized. Now, we don't really know what's happening when we're actually doing fascial work or scar tissue release. Some people say you can break up scar tissue and your body absorbs it. I don't really think that's the case. But I think you can influence its behavior locally, and obviously there's always a nervous system change, but you can influence its behavior. One of the theories is that when the body lays down these collagen fibers, it lays them down in a very haphazard, sort of crisscross manner, and those fibers don't always align themselves in the same direction of the original fibers. So if you have like just a very longitudinal muscle and you had an injury or strain, and then you have stuff that's going sort of this or parallel to it, that's going to affect the mobility. So by doing these various soft tissue release techniques, you can possibly realign some of those fibers to make them a little more mobile. You're not going to get rid of the scar tissue.
It's there for a purpose, right? I mean, it definitely serves a purpose.
Yeah, I mean, it's exactly. And we scar, we don't really recreate the original tissue. So once you have a significant muscle injury, for example, it's not gonna be the same exact muscle it was before.
Right.
But you can still get it back to its proper function, with proper therapy. I mean, and there's a big debate over exactly how it works. We don't know. Some of it's neurological, without a doubt, and some of it is local. You know, some of the research done on fascia, I think that, like, Tom Myers is obviously one of the big proponents of fascia work and his evolution of the Rolfing system with the anatomy trains. I think it's got some holes in the theory, but there's something very valid to it.
Right.
Barnes and his myofascial stuff, and there's a lot of different guys doing fascia work, and they'll all put their own spin on it, but clearly something is happening. Something positive can happen when done appropriately. Doesn't need to be overly painful. ART type work. All of it can be tender, it can be painful. That's not the goal. It's never the goal to just put somebody in pain. But when you have unhealthy tissue, very ischemic tissue, very congested tissue, you often have a very lowered pH, so it's more acidic, and that theoretically it sort of sensitizes sensory nerves and like mechanoreceptors, pain nerves, that they may register as pain even with a light palpation. So the goal over time would be that's going to become less tender, and then after you do this type of therapeutic work, and the hands-on work is always going to be better than the self-myofascial release with foam rollers and golf balls and sticks and Theracane, things like that. Those are better than nothing, and people can do a lot of good work on their own. But after you've done the work, you want to try to follow it up with some active range of motion in that new position, if you've gained any, so that you can incorporate that into your sort of your mind map, sort of create new
neurologic pathways.
Just sort of like new connections. This whole concept of neuroplasticity between the neurons, the dendrites, the synapses, so that your brain actually figures out, oh, I can move here, and then you try to go into these new movement patterns. That's where the mobility work comes in. This is my opinion. I could be way off, but I think there's a lot of people who are doing it this way who are getting good results. It's not that you can't get very good results with just sort of I'm going to get the joint moving again, but there does seem to be something to getting sort of the more soft tissue, collagenous tissues more mobile, and then seeing if that allows the joints to move.
So what you're saying is it's the combination.
It's a combination.
It's not one or the other. It's like
no.
You have to improve the movement, but sometimes the joint's not going to move because there's just too much soft tissue restriction.
Or for some people, there could be capsular restriction, and that's going to be more addressed by like a manual therapist, a physical therapist, an osteopath, maybe a chiropractor who's skilled in that type of work. So sometimes you might need more of a osseous, a more joint approach. You can get the muscle as healthy as you want.
Right.
You keep working on the muscle. It's not improving the joint range of motion. So there could be like an intra-articular lesion that needs to be addressed. So if you're a trainer or a coach and you don't have those skills, which most of them would not, because we wouldn't be licensed to do that, you have to have a network. You have to refer out. That might be sort of the missing link for that person.
Okay.
But there's 60, 70, 80%, I don't know the exact statistics, but there's a lot of people you can help getting their joints functioning better just by clearing up some of the soft tissue stuff.
Awesome.
However you want to call it.
Beautiful. Thanks, Keats.
You bet.
All right.